What's after me? Your optician? So maybe I'll say that on a recording so that they can still come down since it's live.
Right.
And what room am I in?
Fellowship Hall.
Okay. Good afternoon, Cedarfield. My name is Suzanne. I'm from On-Site Dermatology. It is my pleasure to be with you. If you're watching at home and you'd like to join us, we're live right downstairs or wherever you're on campus in Fellowship Hall. And immediately after me at 3 o'clock will be a presentation by Optis. So there's going to be an optical practice starting here as well. So welcome and thank y'all that came to join us in person. And those that are watching at home, please share this with your friends because we're going to cover some important subject ground here. My name is Suzanne. I'm with On-Site Dermatology. We're the nation's leading provider of mobile dermatology services to senior communities. And we come to you so you don't have to transport out. We're going to be offering services right here at Cedarfield. We'll see independent living residents here in the wellness clinic. And for all other health services, be it assisted or memory care or nursing, please contact your health coordinator and they can always schedule an appointment for your loved one. On-Site Dermatology has been around since 2005. We are the nation's leading provider of mobile dermatology care to seniors. So we specialize in geriatric dermatology. Any conditions you or your loved ones might have, I'm sure we've seen before. One, we've been around since 2005, and two, we see over 5,000 seniors a month. So it's my pleasure to be here today and talk to you about healthy skin and skin cancer awareness. Some of you may be aware that May is Melanoma and Skin Cancer Awareness Month. So our goal today is educate you and give you a few things to consider that you can look into and check on your own health from time to time and kind of be monitoring it and bring things to your practitioners if you see a change or a concern. On-Site Dermatology is a full-service dermatology group. We're mobile, so we come to you here at the community. Again, we see people in the Wellness Center for Independent Living. Should you want to be seen at the end of the presentation today, you can sign up with me. Or if you're in independent living, you can always ask the Wellness Center for our phone number or call us directly at 877-345-5300. Then it'll start talking and press the button 1 and that'll get you to scheduling. We offer quality and convenient dermatology care. Basically, anything that can be done in a general dermatologist's office, we can do for you right here. We can diagnose, treat, prescribe, do procedures like cryotherapy, biopsies, ED&Cs, write orders and prescriptions, all from the comfort and convenience of your community. We specialize, although we do general dermatology, we specialize in the detection, prevention, and treatment of skin cancer. And about 99% of skin cancers can be addressed right here at the community. The skin is the largest organ of your body. And interestingly enough, a lot of people don't even consider it an organ. They think of their heart, their lungs, their kidneys, but nobody considers the skin. It is your largest organ, and the best thing it has going for you, it's on the outside. That means that you can be an active participant in your own health and well-being, and we want you to be. You should be monitoring your skin on a regular basis, and you should be checking for changes, for new growths or lesions, for age spots that may not be age spots. If something is new or evolving, that's a key word, evolving, or changing on your skin, you need to notify someone and have them look at that, okay? In addition, you should be getting an annual skin check per the American Board of Dermatology. And we're happy to do those things for you when you sign up for an appointment, okay? Now, as far as on-site dermatology goes, we accept all major insurances, we accept Medicare, Medicare Advantage plans, and if you sign up for an appointment by calling our office directly, We're going to ask you your name, your date of birth, your address, and your insurance information. As with any practitioner, you should always make sure they accept your insurance before you schedule an appointment, and we do that as a standard protocol every month, whether we've seen you the first time or the 7th time. So we are always checking insurances, okay? Okay, here we go. So, as we get older, our skin tends to change, and I'm sure a lot of you have noticed that. You're going to notice your skin gets a little drier as you get older. You're more apt to have skin tears because of that dry skin. It tends to get thinner. It tends to bruise more easily because there's not as much fat layers in the skin. So your collagen's going down, your elastin, so it's not as elasticy. You bump into something, you get a cut or a bruise. It's important to try and take care of your skin the best you can. As we age, we said it gets drier, your skin naturally. So a couple of little tips. 1, moisturize regularly. It's so important. That will help reduce some of the tears you get. 2, when moisturizing, please try and use something with an SPF in it. That's sun protection factor. The same thing that you will find in suntan lotion. A lot of skin cancer is caused by exposure from the sun, the UV rays. That constant exposure is unfortunately damaging various layers of your skin. So when moisturizing, try and use something that has an SPF in it, okay? The other thing is when bathing, please try and avoid either deodorant, soaps, or body washes, or those that smell so nice, because those unfortunately tend to dry out the skin as well. We don't want to compound the aging problem and the dryness. So just try and use a good moisturizing soap so that you'll be on your way and your skin will feel better for it. And remember to moisturize and use something with an SPF in it. On-Site Dermatology deals with numerous skin conditions. And as we've discussed, we have the ability to diagnose and treat and prescribe. A lot of people just think of us as skin cancer experts, which is very nice, it's quite the compliment, but we do so much more. We do annual skin checks, we deal with dermatitis, eczema, shingles, scabies, fungal infections, rashes, as well as growths and those mysterious age spots that just showed up out of nowhere. Sometimes they're not age spots, sometimes it's not just a mole. So if you do see a change in your skin or something is changing or evolving, there's that word again, you should take note of it, okay? Because it's important, these changes. Now, we're going to be talking about skin cancer because it's that month. May is Melanoma and Skin Cancer Awareness Month. So we have a few little statistics for you, and then we're going to get deep into the goods, okay? Skin cancer is the most common form of cancer found in the United States among Americans. More so than lung cancer, or prostate cancer, any other kind of cancer, skin cancer is number 1. And people quite often say, oh, it's nothing on my skin. They'll quite often say that, but that's not what you should be doing. Skin cancer is a form of cancer, and some of the cancers can be life-threatening. So it's important to check your skin, get it checked like a regular physical every year, and that you're going ahead, and if you see something unusual, you need to look into it, okay? There are more than 5.5 million cases of skin cancer diagnosed every year. That number is low. I know this number is low because practitioners are only required to report melanomas. But the most common form of skin cancer is a basal cell carcinoma, followed by a squamous cell, followed by melanoma. So the most common forms aren't even being reported here. So we know that number is a lot higher, okay? All in all, there's a lot of skin cancer out there is my point. 1 in 5 Americans will be diagnosed with some form of skin cancer. My first experience was at age 30. I know you all thought I was so young, right? Okay, so I had this little, what I refer to as my Cindy Crawford mole, right here on my face. And after my second child was born, all of a sudden, it started to evolve. It started to change. I don't remember now if it was shape or if it was texture, but anytime you have something on your skin that is starting to change, that's usually an indicator that something is not right, okay? The odds of developing skin cancer, unfortunately, grow as we get older. For the most part, it's 1 in 5 Americans, but for you lucky folks 65 and older, it's 40 to 50% chance that you're going to have some form of skin cancer, which is almost 1 in 2. So just keep that in mind. It's not to concern you or worry you, it's to inform you, because the more knowledge you have, the better you can be involved in your own health. I love these pictures. These are some really great pictures. So we said that the sun is a very strong power, and a lot of our skin cancer is caused by UV damage, ultraviolet damage. So we get that ultraviolet rays from the sun. So if we look at this pretty lady over here, her skin looks pretty darn good. But when we look at her under a special UV camera, we can see all the spots and the UV damage to her skin, right all over her face. Now, when I come over to this guy, and this is a really great one, can they see these, Eddie?
Yes.
Perfect. Okay, most of us age symmetrically. That means what happens to the right side of our face happens to the left side of our face. If we go out in the sun and we're walking, we get a little pink all over our face. But in this instance, this gentleman, the right side of his face is absolutely beautiful. His skin is almost flawless. And when we look at the left side of his face, we see a lot of ultraviolet damage. We see a lot of skin cancer in here, all over his face. Can anyone in the audience tell me as to why they think he is so unbalanced, not symmetrical? Yes?
Probably the left side is with the driving side.
It is his driving side, you're right. And the left side is his driving side. This is a professional truck driver. So that is constant exposure, time and again, to the window side. So you can really see the UV damage here, which is what the point is we're trying to hit home. This guy should have been using a lot of sunscreen, and I don't think he was. Okay, now, we're concentrating and focusing our discussion today on skin cancer and pre-cancer. Does anyone have an idea what a pre-cancer might be called? Can anyone name some of the 3 main types of skin cancers? I mentioned one already.
Melanoma.
Okay, I heard basal. Squamous. And melanoma. Those are the ones where you have a great group here. I like it. Good job. Okay. I used to be a teacher, so at any time, I'll take questions anytime you have them. Just call them out. And I love interaction, so please feel free. People at home, if you want to come down and join us, you're more than welcome to do it, or you can rewatch this feed. People in the audience, I expect your participation. I love it. So let's talk about precancers. Precancer is called an AK, or an actinic keratosis. It is in the beginning stages. It hasn't made that big transition yet. But as with anything that is pre or before, it's really important to try and get that treated and addressed before it develops further. When these are left untreated, over time, it can develop into a squamous cell carcinoma. So we want to take care of that precancer before. Then we have the basal, the squamous, and the melanoma. These go in order from least aggressive to most aggressive and most dangerous. And they go in order from most common to least common, which is good for us because this is the most serious thing, but it's the least occurring. It still occurs, but it happens the least frequently. Okay, so we're going to look at some slides in just a moment, but let's talk about the AK. The actinic keratosis is a precancer. It accounts for about 60 million Americans being diagnosed with it every year. Many of you have probably been diagnosed, may not even know. When you go to the dermatologist, if you've been sprayed up with the cryotherapy or the liquid nitrogen freezy spray, that's because they're spraying those AKs. We want to address the AKs before they develop further. AKs, as with the majority of our skin cancers, are found on the sun-exposed areas, which means your face, top of your head, top of your ears, back of your neck, nape of your neck, top of your arms, top of your hands. You can get skin cancer anywhere on your body, even where the sun doesn't shine. However, the majority of it is on the sun-exposed areas, okay? So what's an AK, a precancer, look like? Well, it can look different ways on different people. It can look different ways on the same person. So I have a few examples here. Here I see some thicker scaly patches, here, here, and here. Here I see some tan and pink spots on the top of this person's scalp. And a lot of people go, oh, well, you know, there's no hair anymore, so I just didn't see it before. No, that's also precancerous. Over here I have some red crusted lesions, a little more defined over here. And here I have a crusted lesion on the lip. Now, if you want to avoid this, I would suggest you go buy something like a lip balm, either chapstick or the other one, CVS's, but you have to make sure it says SPF on it, because all of those lip balms will make your lips nice and soft and moist, but only the ones that say SPF on them will protect them from the ultraviolet damage. Pointing it the right way? Okay. Now we're going to move on. We're going to talk about those three main skin cancers. The first one is the basal cell carcinoma, also referred to as a BCC. So, it affects well more than 4 million people a year. It is the most common form of skin cancer, accounting for about 75-80% of all skin cancers every year. Most commonly, it is found on the sun-exposed areas. So as we said before, face, top of the head, top of the ears, back of the neck, nape of the neck, top of the arms, top of the hands. You can get this anywhere on your body, but those are the most common places. The good thing about the basal cell, usually it doesn't spread, and it's not typically life-threatening, but it is skin cancer. It will continue to grow and destroy the surrounding tissues. So when I had skin cancer here, it was a basal, and they removed it, because they didn't want it growing or affecting the surrounding tissue. But the good thing is, this doesn't typically tend to grow inward, where we can't see things, and it's got a really high cure rate. I have not had a reoccurrence. I was 30 at the time, I'm older now. We'll just leave it at that. You do have a 40% chance of a reoccurrence once you've had basal. So, it may be in the same spot, it may not be. It might not even look the same, but just know that if you have had basal cell carcinoma, you do have a high tendency to have a reoccurrence. I've got some pictures of some basals here, and like the AKs, they can appear differently. So over here, I have what we know as a non-healing wound. It might bleed, it might ooze, it might heal up and come back again in the same spot. This isn't a non-healing wound, this is a basal cell carcinoma. Over here on the tip of the nose, almost looks like somebody was scratching their nose a little too aggressively, and they got a blood spot. It's not. This is skin cancer right here, a basal cell carcinoma. Down here, these are interesting. They kind of look like a scar, but there was never an injury here. And that's the cancer destroying your surrounding skin. Okay? So that's an important one. And then over here, I think of it as my thinker's corner. Like somebody was rubbing their head, maybe they were worried or thinking a lot, and it got real red and irritated or pink. But when you stop rubbing, or an hour later, it shouldn't be red or pink anymore, and this is ongoing. This is a basal cell carcinoma. So I always do this with my audience, and they look at it and they go, okay, I got it, and then I look at it and they go, aha, it's gotta be flat. No, I got a lot more pictures for you. So a basal cell can be flat, it can be raised, it can look like a donut or a divot, it can look like a crater, it could be oozing or bleeding. It could be dry and crispy. I was going to say crunchy, but crispy. It can be moist. It can be different colors. Over here I have a pearlish kind of look, and it's got different shades in it. This one is all raised. This basal cell looks like a donut or a golfer with a divot in the middle there. And over here, this is an enlargement. It's a moist-looking crater. So a basal cell cancer can look many different ways, but the most important thing I want to convey to you today is any type of skin cancer, be it a basal, squamous, melanoma, or an AK, precancer, doesn't look like normal, healthy skin. You should not be walking around with one of these things on your face or anywhere on your body. So it's important, if you see something unusual like this, to bring it to your practitioner's attention or to our attention, and we'll check it out. Because these are all examples of basal cell carcinoma. All right, now we're going to move on. Now we're talking about skin cancer number 2, the squamous cell carcinoma. This is more serious than your basal cell, okay? This will continue to grow, and left untreated, it can grow internally towards vital organs. Now I see my friend here shaking his head. Are you medical? No, you just have experience with these things and knowledge. Okay, thank you. Okay, so this is very serious, much more aggressive than your basal cell. Statistically, there are about 1 million cases diagnosed every year. Again, that number is probably low, because medical personnel is not required to report a basal or squamous cell carcinoma. Very serious stuff here. Left untreated, this will continue to grow internally. So I always use the example of an iceberg. And remember the Titanic? They saw the iceberg up top, but they weren't sure how deep it went underneath the water. That's what happens with this. You've got your squamous cell, and you can see maybe a lesion or a growth on top of the skin. We don't know how deep down it goes, and it will continue to grow if left untreated. So we want to take care of that. It can be fatal, but it's typically easy, can be treated, and has a high cure rate. But that's when caught earlier on. So we want to make sure that if you have that, we're addressing your needs and taking care of. Now, for all of you folks out there that have had beautiful blue eyes and green eyes and made all of us envious for years and years, unfortunately, you are more of a candidate for a squamous cell carcinoma. If you're fair-skinned, blue eyes, green eyes, redhead, or blonde, now, or if you were, you are definitely more a candidate for this. So what does a squamous cell look like? Well, I've got some pictures of these too for you. Over here, it's almost like a wart with a little pointy, stiff area on top. We call that a horn. This is one example. Over here, I have a different type of non-healing wound. And quite often I look at that and it looks like somebody got a cut and it got infected while it was healing. If you have a cut that's not healing, or you have an infection in the cut, you should be getting it checked out anyway. But that point aside, this is also not an infected cut. This is a non-healing wound. This is a squamous cell carcinoma. Moving over here, I have a crispy, dry area on the tip of the nose. And not as common, I have a moist growth or lesion under the nail. These are all examples of a squamous cell carcinoma. And yes, I have more. Over here, I have a drier looking crater. Over here on the lip, I have a thicker crusted over growth. And down here, these are flat, but they are discolored a little bit. And they're discolored because at one point they were oozing. Okay? So it's important that if you have something on your skin that doesn't look like normal, healthy skin, that you are getting it checked out. Because it's all in the earlier detection. As soon as you find something, it can be treated and hopefully not get to this stage. That's the important thing. People quite often tell me, oh, I have a dermatologist. And I say, great! When's the last time you saw them? And they go, oh, well, it's been a while. If you have a dermatologist that you love, that's okay. Please go to them. Or you can come to us. We do come to the community every month. And we have quite a few people that what I call two-time. Maybe they see their regular dermatologist once in a while, but oh, we happen to be here today, so they're going to come and make an appointment with us, and that's okay too. The important thing is that you're getting things checked out on your skin. Now we're going to talk about the biggie, number 3, melanoma. The melanoma is really important that you get this addressed. This can be life-threatening. There are about 180,000 cases of melanoma diagnosed every year. It's a life-threatening skin cancer, and it is extremely aggressive. It is fast-moving, fast-growing. Unfortunately, it is responsible for about 75% of skin cancer deaths. Now, it's estimated about 1 in 50 people will get melanoma sometime in their lifetime. However, my odds are doubled, 1 in 25, because I have had more than 5 sunburns in my life. So if you have had more than 5 sunburns in your life, you're in that doubled category as well. 1 in 25 as a chance of having a melanoma, okay? It's really important that you're checking your skin regularly. If you see something like this, we want to definitely address it right away. We're going to go through the ABCs of skin cancer just after this and give you an idea of what to look for, okay? The important thing to note, I'm a very much half glass full kind of girl. This is highly curable when addressed earlier on. The thing is, you got to catch it, okay? All right, so let's look at something here. This is my favorite slide in the whole presentation. Now, I know it says melanoma up here, but it applies not only to melanoma, but to all skin cancers. These are my characteristics of skin cancer. So a couple of things. 1, just because you have a characteristic on one of your moles or age spots of these doesn't mean you definitely have skin cancer. The other thing to note is you don't have to have all of these for something to actually be skin cancer. It's just these are major characteristics that we find time and again in skin cancer, okay? All right, so the first thing we're going to talk about is when something is asymmetrical. When something is symmetrical, that means the left side and the right side are balanced. So if my left side rounds out, my right side rounds out. If the top is flat, the bottom is flat. When something is asymmetrical, that means it's not symmetrical. So the top might be flat and the bottom might be wavy. This side might bounce out and this side might bounce in. Or you could have 3 bumps up here and then a straight kind of line on the bottom. When something is asymmetrical, that's a characteristic of skin cancer. B is for borders. And when the borders are irregular, that's a concern or a warning sign to us. So I want you to all imagine if you had a ballpoint pen and you use the ballpoint pen on a piece of paper towel, press really hard and make a circle. You're going to get a crisp, clean, defined border. That circle is going to look like a pretty good circle. Now, imagine the same paper towel. If you have that paper towel and you drew a circle with a felt tip marker or a Sharpie, something like that, it's going to, or a flare, it's going to spread and seep into the edges of the paper towel. You'll no longer have that crisp, clean, defined border. You'll have an irregular border, and we'll show you pictures of this. So we don't like those irregular borders because they're sometimes a problem. C is for color. So we have A is asymmetrical, B is borders, C is color. We do not like it when we see a mole or a growth or an age spot with multiple colors in it. We don't like it when it's like that and it's variegated. We prefer it to be all one consistent color, all dark, all tan, all blush colored, whatever it is. We like one whole color. We do not like when it's variegated. D is for diameter. The diameter is the distance from one side of a circle to the other, right through the middle. So we like to, and when I say we, I'm not just referring to on-site dermatology. This is like a rule of thumb for all skin and dermatology. D for diameter, we like it to be smaller. If your diameter is less than 6 millimeters, that's good. If it's larger than 6 millimeters, that's a concern for us. So who here knows what 6 millimeters is? That's typically the response I get. So you got to use your imagination here. This is a yellow school pencil, right? Just work with me on that. And it's got that pink little eraser on the end of it. I'm sorry I don't have the actual yellow pencil, but this will have to do. So when you're doing a diameter check, you take the pencil, you turn it over, and you take the pink eraser. You try and cover that spot on your arm or wherever it is. If it's covered, it's less than your 6 millimeters. If you still see the growth or the mole or the age spot outside the area of the eraser, that means it's larger than we would like. And then lastly is E, evolving. That means your growth, your mole, or your age spot is changing or evolving over time. Anytime that thing on your skin is changing, probably not a good thing. Something you want to check out. So these are our key characteristics, not just of melanoma, but all skin cancers. Now everybody's got this down, right? Good, okay, because now we're gonna put you to the test. Okay. This is my other favorite slide. So, this column, all of these are perfectly healthy moles. They happen to use a mole as an example. Everything in this column is a melanoma. So let's start with A, asymmetrical. When something is asymmetrical, it doesn't match on both sides. When I look at this one, it's just about perfectly symmetrical. The left side bounces out, the right side bounces out. The top is a little bit rounded, the bottom shape is a little rounded. This is symmetrical. But when I look at this one, I've got one big bump outward on the left, and it comes in on the right. On the top, I've got 2 bumps. On the bottom, I've got 1, 2, 3. So is this one symmetrical or asymmetrical? Good, it's asymmetrical, and that one is my melanoma. Okay, let's go to B. What was B for?
Borders.
Borders. I like it. Whoever's yelling out there, you keep doing it, and whoever's not over there, you start. Okay, B is for?
Borders.
Borders. Okay, so that was the paper towel example. And I said if you press really hard with your ballpoint pen, you'll get defined edges. But if you're using a marker or a flare or a felt tip, it's going to seep into the paper towel and you're going to get an irregular border. Well, this is a pretty clear, crisp border right around the edge of it. But when I look at this one over here, it's an irregular border. I can't necessarily tell where the healthy skin ends and where the melanoma begins. This one is my melanoma. Now do we understand a clear border versus an irregular border? You got to talk up for TV land, they can't hear you.
Yeah.
Okay, good. All right, C stands for? Color. It's also right here, but you may not be able to read it from a distance. C stands for color. So, this one's all kind of pinkish toned. That one's pretty dark looking. That's for the most part all one tone in tan. And then another pinkish tone one. They're all pretty consistent in color. That's good because these are all healthy moles. But when I look at this one, I see a little pink on the trim, then it's darker brown, then it's like a flat colored brown with some white flecks in it, lighter brown, and a pinkish brown. So is this consistent in color or is it variegated? It's variegated. That's my warning sign, and that's the melanoma. Then I have D. D stands for? Diameter, which is my pencil test. They didn't give me a pencil for this, but we're going to pretend my hand is a pencil. In this one, the pencil covers the eraser. Remember, we flip the pencil over, and we cover it with our eraser. This one gets covered. But when I flipped it over here, A good half of it is still showing. And then there was one more, E. We did A, B, C, D, E. What was E?
Evolving.
Evolving. I said it so many times because it's not on the list. It's not on the list because it wouldn't be very ethical for a doctor to take a picture of somebody with a melanoma and let it progress, right? So, we don't have something evolving here, and I also can't show you 50 different pictures of a melanoma. But E is evolving. So it's really important that if you have any of these characteristics, and you should check your skin, and I did see some people looking at their skin while we were here, that you are getting your skin checked on a regular basis. Because that age spot, that really dry patch, that growth or that mole, it may just be nothing, but it could be more serious. I want you to keep in mind, we specialize not only in skin cancer and skin cancer treatment and such, and identification, but we're also dealing with your regular everyday problems at On-Site Dermatology, be it eczema, psoriasis, shingles, scabies, any kind of growths, fungal infections, you name it, we can take care of it for the most part, and if we can't, we will refer you out. I believe I said it earlier on, we do accept Medicare, it's Part B, which is for doctor's offices, Medicare Advantage plans, as well as other numerous commercial insurances. If you're interested in scheduling an appointment with On-Site Dermatology, we come out here once a month. Independent living, you can call us directly, 877-345-5300, then press 1 for scheduling. Or if you can't find the number, just reach out to your wellness clinic and they can certainly get you in touch with us. If you're calling for a loved one, which is in healthcare services, assisted, memory care, or nursing, you can speak to your clinical team there and they can get you set up on the appointment list for your loved ones. As far as dermatology goes, folks, I want you to go outdoors. I want you to enjoy the sunshine. I just want you to be a little more cognizant. You've learned a lot from me today, so now I'm going to test you. This is a melanoma. When I first started at On-Site Dermatology, they said, Suzanne, do you know what that is? And of course, the word melanoma was not pasted over it, so I said, oh yeah, it's an age spot. My parents have tons of them. No, wrong answer. So, let's look at it. It looks to me more like a dog print, right? As we wrap up here, we're just going to finish with this last little thing, and then you're going to stay tuned for my next guest here. But it looks like a dog print. There's one big bump here, and then there's 1, 2, 3 paw prints here. So is that symmetrical or asymmetrical? Good, it's asymmetrical. Okay, B stands for?
Border.
Borders. See, there's no words now, guys. We're really testing you. B stands for borders. And when I look at this, I do not see the clear, crisp, defined border from the ballpoint pen. Sometimes in here, it's kind of hard to tell where the healthy skin ends and the melanoma begins. So I have irregular borders here. Next was C. What was C for?
Color.
Color. Good job. So color. Here it's darker. It's got a little lighter flecks over the top. It's got a little pink, and it's a lighter tan. So is the color consistent or is it variegated? Variegated. Not good. Okay, we don't like variegated. And then as far as the eraser test, or D for diameter, I honestly don't know how big or small it is. It's on somebody's hand. So it could be, it doesn't have to have all of those characteristics. I don't know about the size of it. And then E is evolving. And I can only guess that it evolved quickly because it is a melanoma. So as far as on-site dermatology goes, we want you to enjoy the outdoors. We want you to go out there and get a little sun, fresh air, and exercise. We just want you to be cognizant of what you're doing. If you have some form of skin cancer, there are numerous treatments that we can utilize to help get rid of that and resolve your problems. Okay, we can use the cryotherapy that we spoke of, typically used on a pre-cancer. It's a few sprays and it kills the pre-cancer. We can use topical creams and prescriptions like Effudex. Effudex is a very strong cream. It's like a cream form of a chemotherapy. So some people are a little sensitive on that and are not comfortable doing that because it's intense. Some people it works great on. It will get worse looking before it gets better, the skin cancer, because it starts to look very aggravated when we use the Efudex on it. And reddens up and flares up and it looks even worse, but it's actually treating it. There's also an ED&C, electrodesiccation and curettage. That's something we can do right here at the community to address 99% of skin cancers. And then there's a surgical excision or Mohs surgery. We're not surgeons. Our practitioner, Leslie, is an NP specializing in geriatric dermatology. That's all she does for us all day long is go to senior communities. But she's not a surgeon. So if your plan of care says that you need to have surgery on something, we will refer you out and talk to you about a provider in the area that does whatever procedure you may need. Okay? What I want you to do is just make sure you're being cognizant of your surroundings. If you're outdoors, put on the sunscreen. Wear maybe a lightweight long sleeve shirt to protect you a little bit from the sun. Wear a hat. Sunglasses. I know the optical guys in the back are saying, yeah, sunglasses, very important. You could have permanent damage to your eyes from the UV damage. So it's important to protect your eyes with UV sunglasses, okay? Ultraviolet protection. Remember the chapstick, they're not all the same. You have to find one with an SPF in it. And in that, I conclude with you, but I do beg you, I'm suggesting highly that whoever your practitioner is, or we're happy to see you, make sure you're checking your skin regularly. Make sure you're getting your annual skin checks as recommended by the American Board of Dermatology. Okay? I want to thank you all for coming, and now I want to see if anyone has any questions. Yes?
When you say we, in other words, when they're coming to Cedarfield, we develop a relationship with somebody, or is it anybody different?
That's for you. The question was, when we say we, are we developing a relationship? Yes, On-Site Dermatology is going to be coming out to Cedarfield once a month with our practitioner, Leslie McElroy, and she is the one provider, so it's not multiple providers that come. We want you to develop a relationship with that practitioner. And she comes not only to IL, she goes to AL, memory care, and nursing. Okay? Anyone else have questions? Yes, please.
Just a reminder for women who wear nail polish and then they never take it off prior to going to having it done again, that they need to have it taken off to be able to look at their nails.
Good point. I was wondering where you were going with that. I like it. So it was recommended make sure you're taking off that nail polish. When you do, you're checking under your nails, your skin under there. Okay? Because if it's always covered, you never know what's possibly growing under there. Could be healthy as it could be. Could be a skin lesion. It could be a fungal infection, which quite often happens under the nails and we don't see it. Any other questions?
I had a question, Suzanne.
Yes.
You hear the different types of sun protection, like 30, 45, 50. I mean, what do you recommend in order to go?
Well, one, I have to tell you, I am not medically trained. I am with sales and marketing, so legally I can't answer any medical type questions.
Okay.
Personally, what I do is I'm not sunbathing. I'm not that girl anymore. So I go with a typical 20 or 30. It's built into my moisturizer, and that's good enough for me because I'm not sitting out there all day long. One of the main things about using suntan protection is questioning on how long you're outdoors, and is it middle of the day for a good hour that you're having lunch outside, or are you running back and forth to a car or across the yard? So if you're not running out back and forth a lot, a thinner type is fine as long as you're not outside for any substantial time. The other thing, but you should wear something, okay? The other thing is application. You go to the beach, or if you're sitting outside watching an outdoor event or performer, or you're having lunch outside for a long afternoon, a lovely lazy afternoon, you need to reapply. Because if you don't, you're still getting those rays coming through. So application, and you have to consider the timing that you're outside and the length or duration. Those are also important factors.
Thank you.
You're welcome. Anyone else? Okay, so what I'm going to do is, many of you Snuck in the back, I have some goodie bags. I have them on chairs. If you didn't get one, you and I can actually hand some out maybe to some of the folks. If anyone is interested in scheduling an appointment with On-Site Dermatology for themselves, or if they have a loved one over in continuing care at any point, just come see me. I'll be over here, and we're going to give it a 5 minutes, 2 minutes. What do you need? 5 minutes to just switch it over, because Optice will be right up here in a moment, and they're going to be speaking to you, and it's important to be staying tuned for that, okay? So with that, I say thank you from On-Site Dermatology, and we look forward to seeing you. Thank you.